The big thing with Sculptra is that it stimulates collagen production, and collagen is really important for young, youthful-looking skin. Collagen is the building block for radiant, healthy, vibrant skin. As we start to lose collagen, about age 30 is when it starts to happen. We see some visible signs, which is flattening of the cheeks, the fat pads start to disappear, the formation of lines and wrinkles start to happen. So basically, we're turning back the clock and giving our face structure that we once had when we were younger. Around age 40, we start to lose the deep fat compartments of the face. So we start to look tired and gaunt. Around age 40 to 50, we start to get bony reabsorption or remodeling. What happens there is we lose the architecture of the face. And so as we lose the architecture of the face, our cheekbones start to flatten, the orbit of the eye starts to get wide, the brow bone starts to descend, we lose our jawline, and our face just becomes flat and we start to sag. So the thing with collagen, which is polylactic acid, is we can restore all those things. We can also address the skin, so we can make the skin look less saggy. It can look healthier, the texture looks better. All those things can happen with Sculptra. Sculptra is a fertilizer for the face, so we can keep our collagen production nice and healthy as we get older. I think it's an essential component to facial rejuvenation, and it highlights the cheekbones, the deep fat pads, and the structure of the face. It's not used in place of dermal filler, but it's used in addition to. Where dermal fillers are contouring the face, this is giving that architecture back to the face and imitating those deep bony structures and fat pads of the face. Sculptra is a long-term product. The particles can be found in the body anywhere from 4 to 23 months after it was injected. So after that Sculptra is out of the body and gone, the collagen you keep for a very long time. The study that was done with Sculptra was stopped at 2 years, and there was still an 80% satisfaction result. Anyone experiencing collagen loss is a candidate for Sculptra. 30s, 40s, and 50s is the average age when we start to see that collagen go away. And at that time is when we want to start addressing the collagen loss and recommending Sculptra to our clients. So the other thing we do with Sculptra is we do skin conditioning. We perform skin conditioning to make that skin look more radiant and healthy and glow, have less fine lines and wrinkles, just look beautiful. This is a beautiful treatment for those people that just have the radial cheek lines, that just feel like their texture doesn't look good, and you don't want to put filler here because you don't want it to look, you don't want to see it, you don't want to add volume, but you just want to make that skin look better. This is a beautiful treatment for it. Hello, we are talking about gluteal augmentation, and we have a wonderful model here who already has a great buttocks, but she just wants a little enhancement, a little lift, and then a little bit of help through the dimpling area. So we can definitely achieve those results with Sculptra. So the first thing I like to do is talk about the anatomy of the buttocks and then mark so we know where we're going to put the Sculptra for the most lifted results. So what I do to start is I'm going to have the patient go ahead and clench or squeeze, contract your buttocks. So we know the top of that buttocks is here. So I'm going to go ahead and mark it here. So go ahead and relax. Then I'm going to find the apex. So think of the buttocks like a C. The apex is where the highest projection is. So her apex is about here. To lift this portion, this lower portion, if we put Sculptra here, she's going to get a lift like this, which is what we want. So we want most of the volume with Sculptra here in this area, in this region. The next thing I address is the hip dip, and she doesn't have much of a hip dip. We've already talked about it, and she's fine in that area. So I would rather put the bulk of the Sculptra in this area today. The next thing I do is I want to be about 6 centimeters in. I don't want to put it by that intercludial cleft. I want to be about 6 centimeters in. So I'm going to start my injections about here. And the same thing, where I want that volume here, I'm going to end my injections about here. So this is the area that I'm going to do the bulk, and that's where she's going to get this nice lift. Then these little few dimples, I mean, she barely has anything. I'm going to do a little bit of Sculptra in that area, just to kind of pop out and help with the texture there. Now with gluteal augmentation for the buttocks, it's anywhere from 8 to 10 vials for the first treatment. Some people need 2 treatments, some people need 3 treatments, some people are completely happy with after they have the first one. So I've marked the patient where we want to focus on the volume, where she has just a little dimple on each side. So I am going to use a cannula. So I've got a 22 gauge 2 3/4 cannula. So I'm going to go ahead and enter, and then I see she's not super fibrous, which is nice. So you can see the tip of my cannula is all the way over here. So I'm just going to lay nice even thread, so she's going to feel pressure over the whole area. Doing okay pain-wise? I'm going to go ahead and massage this side. I'm going to use a little hypochlorous acid on my hands, which is an antimicrobial, and I'm going to give a nice deep massage. Now she doesn't have to massage this hard when she's at home, but I want to disperse all that polylactic acid through the area so she doesn't have any nodules or any lumps or bumps. Now she's going to feel really full in the area today, but that's going to soften up as that bacteriostatic water absorbs. And then the magic will start to happen where she starts to build her own collagen. So we have the beautiful Meredith here, and we are going to do some Sculptra for a little bit of rejuvenation. So I've done some markings on Meredith, and these are the places that I start, assess, decide if they need that area injected, and then if not, then I avoid that area and go to the next area. I want to be in that pre-zygomatic space. So I'm not in the tear trough, but I'm just right under that orbital bone. So we can have a little bit of rejuvenation in that area. So now we're going to talk about skin conditioning. A common area that women start to age is their chest. A lot of times it's sun damage, which is probably Tara's case here because she loves the sun. Don't think she's great about sunscreen. She's trying to be better. So we want to rejuvenate this area from the sleep lines we start to see in the chest, the texture, basically the skin quality. I am going to start one pilot hole here because I can get this whole area here. That's about as long as my cannula is. One here, I can get the same thing here, here, and just depending, I may need one more out here. But this is the entire area that I want to get. So, little poke, little sting deer. Just give her a little bleb here, and a little bleb here. That should anesthetize that area. So this is great for people that wear V-cut shirts and just feel like their chest doesn't match their face. They see more sun damage, they see laxity, lines and wrinkles that they don't have in the face, but they see it in the chest. This is a great treatment for those clients. Okay, and that's all. So I'm gonna massage her and then she'll massage at home. She's gonna have a beautiful result. Thanks for watching.